You are sitting in your doctor's office. The nurse wraps that tight gray cuff around your upper arm. It squeezes. It releases. And then she looks at the screen, pauses for half a second too long, and says, "Your blood pressure is a little elevated today." A little elevated. Those three words land in your chest like a stone, because you know what elevated blood pressure really means. It means that right now, at this very moment, your heart is slamming blood through your arteries with more force than your body was designed to handle. It means the delicate walls of the blood vessels inside your brain, your kidneys, and your eyes are being stretched and damaged with every single beat. You cannot feel it. You cannot see it. But the destruction is happening 24 hours a day, 7 days a week. And the terrifying truth is, most people do absolutely nothing about it until they are lying in an emergency room after a stroke. Welcome. I am Dr. Franklin Reed, and today I'm going to place a powerful, drug-free, scientifically validated tool directly into your hands. I'm going to teach you specific pressure points on your own body that, when stimulated correctly, can measurably lower your blood pressure in a matter of minutes. This is not folklore. This is not a social media gimmick. What I am about to show you is rooted in acupressure, a branch of traditional Chinese medicine that has been practiced for over 3,000 years and is now being validated by modern clinical trials published in peer-reviewed cardiology journals. The American Heart Association acknowledges that stress reduction techniques, including acupressure, can play a supportive role in blood pressure management. The UK's National Institute for Health and Care Excellence, or NICE, emphasizes that lifestyle interventions should always complement pharmacological therapy for hypertension. In this video, I'm going to explain exactly why these pressure points work at the biological level. I will teach you 5 specific pressure points, the exact location of each one on your body, the precise technique to stimulate them, and the medical science behind how each one communicates with your nervous system to force your blood vessels to relax. But I need you to commit to watching this entire video. If you skip to a random pressure point and start pressing randomly without understanding the biology of why it works, you will get 0 results, and you will dismiss this as nonsense. Worse, if you press certain points too aggressively in the wrong direction, you can cause bruising or nerve irritation. The technique matters. The sequence matters. If you are ready to learn a skill that you will use for the rest of your life, every single day, let us begin. Before I show you where to press, you have to understand why pressing on a specific spot on your hand or neck can possibly change the pressure inside your arteries. Because if you do not understand the mechanism, you will never trust the process, and you will never do it consistently. Your blood pressure is controlled by 2 major systems working together inside your body. The first is your heart, which acts as a pump. The stronger and faster it pumps, the higher the pressure. The second is the diameter of your blood vessels. When the muscular walls of your arteries tighten and constrict, the same volume of blood is being forced through a narrower pipe. The pressure skyrockets. Now, what controls the tightness of those arterial walls? Your nervous system. Specifically, the balance between 2 branches of your autonomic nervous system. The first branch is called the sympathetic nervous system. This is your fight or flight system. When it is activated by stress, anxiety, anger, pain, or even chronic poor sleep, it sends electrical signals to the smooth muscle surrounding every artery in your body, commanding those muscles to clench tight. Your blood vessels narrow, your heart rate increases, your blood pressure rises. This response was designed to save your life in a moment of physical danger, flooding your muscles with high-pressure blood so you could run from a predator. The second branch is called the parasympathetic nervous system. This is your rest and digest system. Its primary nerve, the vagus nerve, is the longest nerve in your entire body. It runs from your brainstem all the way down through your neck, your chest, and into your abdomen. When the vagus nerve is activated, it sends a completely opposite set of signals. It tells your heart to slow down. It tells your arterial walls to relax and dilate. It commands your adrenal glands to stop producing stress hormones. Your blood pressure drops. The problem with modern life is that the sympathetic system is almost always winning. You are stressed about money. You are stressed about work. You are stressed about your health. You are consuming caffeine, processed food, and inflammatory oils. You are sleeping poorly. You are bombarded by noise, screens, and bad news. Your sympathetic nervous system is firing constantly, keeping your blood vessels clenched like a fist 24 hours a day. This is where acupressure enters the picture. Specific points on the surface of your body sit directly on top of, or in very close proximity to, major nerve pathways that feed directly into the vagus nerve and the parasympathetic nervous system. When you apply sustained, firm pressure to these points, you are physically compressing the nerve fibers underneath. This compression sends a powerful afferent signal, a signal that travels from the surface inward, up through the nervous system and into the brainstem. The brainstem receives this signal and interprets it as a command to shift the balance. It dials down the sympathetic system and dials up the parasympathetic system. The vagus nerve fires, your heart rate slows, your arterial walls relax, your blood pressure drops. This is not magic, it is neurology, and it is measurable. A clinical trial published in the journal Evidence-Based Complementary and Alternative Medicine showed that acupressure applied to specific points significantly reduced systolic blood pressure in hypertensive patients within 15 minutes. Now that you understand the mechanism, let us go through the 5 pressure points one by one. The first pressure point is located on your hand. In acupressure, it is called large intestine 4, or LI4. Its common name is the hand valley. To find it, hold your left hand out in front of you with your palm facing down. Spread your thumb and index finger apart. Look at the fleshy, muscular web of tissue between the base of your thumb and the base of your index finger. That thick, meaty mound of tissue is the target. Now, take the thumb of your right hand and press it deeply into the center of that mound, from the top. Place your right index finger underneath your left hand for support. You should feel a deep, dull ache radiating from the spot. That ache means you are on the correct point. If you feel nothing, you are too close to the edge. Move deeper into the center of the web. Once you have found the point, apply firm, steady pressure. Do not jab, do not bounce. Press and hold. While maintaining the pressure, perform slow, small circular rotations with your thumb. 30 rotations clockwise, followed by 30 rotations counterclockwise. This entire process should take approximately 2 minutes per hand. Then switch. Repeat the exact same technique on your right hand. Large intestine 4 is one of the single most studied acupressure points in the entire body. Research has demonstrated that stimulating this point triggers a measurable reduction in sympathetic nervous system activity. It lowers cortisol levels, it reduces heart rate, and because it sits directly on the pathway of the radial nerve, stimulating it sends a powerful parasympathetic signal through the brachial plexus and up into the brainstem. Many patients also report that pressing this point significantly reduces headache pain, tension in the jaw, and anxiety. All of these are symptoms of an overactive sympathetic nervous system. One critical medical warning: if you are pregnant, do not stimulate this point aggressively. LI4 has been traditionally associated with inducing uterine contractions, and while the clinical evidence is debated, it is best to avoid deep pressure on this point during pregnancy as a precaution. The second pressure point is on your inner wrist. In acupressure, it is called pericardium 6, or PC6. Its common name is the inner gate. To find it, turn your left arm so your palm is facing the ceiling. Look at the crease where your wrist bends. Now, place 3 fingers, your index, middle, and ring finger, across your wrist, starting from the crease. The point is located directly beneath your ring finger, in the center of the underside of your forearm, between the 2 prominent tendons you can see and feel. Press your right thumb firmly into that point. You will feel a deep, slightly electric sensation that may travel into your fingers. That is exactly right. You are compressing the median nerve. Hold the pressure firmly and perform slow circular rotations for 2 minutes. Clockwise first, then counterclockwise. Repeat on the opposite wrist. Pericardium 6 is remarkable because it sits directly on the median nerve, which feeds into the autonomic nervous system through the brachial plexus. Stimulating this point has been clinically shown to reduce heart rate variability in a way that favors parasympathetic dominance. It is the same point that is targeted by anti-nausea wristbands because the vagal response it triggers also calms the stomach. For blood pressure, this point is especially effective when your hypertension is driven by anxiety or emotional stress. If you are the type of person whose blood pressure spikes in the doctor's office, what we call white coat hypertension, pressing pericardium 6 for 2 minutes in the waiting room before your appointment can measurably calm your nervous system and give a more accurate reading. The third pressure point is on the back of your neck. In acupressure, it is called gallbladder 20 or GB20. Its common name is the wind pool. To find it, place both of your thumbs at the back of your neck, right where your neck muscles meet the base of your skull. Slide your thumbs outward, away from the center, along the base of the skull. You will feel a distinct, small hollow or depression on each side, just behind the large muscles. These two hollows are the pressure points. Press both thumbs firmly upward and inward into these depressions simultaneously. The pressure should be directed toward the center of your head, as if your two thumbs were trying to meet inside your skull. You will feel a deep, satisfying ache. Hold this pressure steadily and perform slow circular rotations for 2 to 3 minutes. Gallbladder 20 is an extremely powerful point because of its anatomical location. It sits directly adjacent to the suboccipital nerve group and is in very close proximity to the vertebral arteries that feed blood directly to the brainstem, the exact region of your brain that regulates blood pressure. Stimulating this point creates a direct neurological signal to the vasomotor center in the medulla oblongata, which is the master control panel for arterial tone. Clinical trials have shown that stimulating GB20 can reduce both systolic and diastolic blood pressure. Additionally, this point is extraordinary for relieving tension headaches, neck stiffness, and the chronic muscular tightness that many hypertensive patients carry in their upper back and shoulders. That muscular tension is itself a symptom of chronic sympathetic overdrive, so relieving it creates a positive feedback loop that further lowers blood pressure. The fourth pressure point is on your foot. In acupressure, it is called liver 3 or LV3. Its common name is the Great Surge. To find it, remove your shoe and sock. Look at the top of your foot. Find the gap between your big toe and your second toe. Now, slide your fingers slowly up along that gap, moving from the toes toward the ankle. About 2 finger widths up from the base of the toes, you will feel the two bones converge into a V shape. Right before those bones meet, in the soft depression between them, is the pressure point. Press your thumb firmly into this depression. You will feel a sharp, tender sensation. That tenderness is completely normal and actually indicates that this point needs stimulation. Apply firm, steady pressure with slow circular rotations for 2 minutes per foot. Then switch feet and repeat. Liver 3 is considered one of the most important points in all of acupressure for treating hypertension. It is called the Great Surge because it is believed to regulate the smooth upward and downward flow of energy in the body. And, in Western medical terms, this translates directly to vascular regulation. Stimulating this point has been shown in clinical research to promote vasodilation, the widening and relaxation of blood vessels, particularly in the peripheral arteries. This point is especially effective for people whose high blood pressure is accompanied by irritability, anger, red eyes, or headaches concentrated around the temples. In traditional Chinese medicine, these are all signs of what is called liver yang rising, which in modern physiological terms corresponds to excessive sympathetic activation driven by emotional stress and frustration. Interestingly, liver 3 and large intestine 4 are often used together in clinical acupressure. When stimulated as a pair, they are known as the 4 gates, and they create a system-wide parasympathetic reset that is considered one of the most powerful calming combinations in the entire acupressure system. The fifth and final pressure point is on the very top of your head. In acupressure, it is called governing vessel 20 or GV20. Its common name is the 100 convergences. To find it, place the tips of your index fingers at the top of each ear. Trace a straight line upward from both ears toward the top of your head. Where those two imaginary lines meet, right at the very crown of your skull, is the pressure point. You will feel a slight depression or softness in the bone. Place your middle finger on this point and press down gently but firmly. Do not press as hard as you did on the hand or foot. The scalp is thinner and more sensitive. Apply moderate pressure and perform slow, gentle circular rotations for 1 to 2 minutes. Governing vessel 20 is a point that sits at the intersection of multiple cranial nerve pathways. Stimulating it has been shown to promote a profound sense of calm and mental clarity. In clinical acupressure for hypertension, it is used specifically to counteract the rising sensation, the flushed face, the pounding in the ears, the dizziness that many people with high blood pressure experience. This point is also remarkably effective for reducing anxiety, calming a racing mind, and helping patients who struggle with insomnia caused by hypertension. It is the ideal point to end your acupressure session with because it creates a settling, grounding sensation that anchors the calming effects of the previous 4 points. Now that you know all 5 points, let me give you the exact structured daily protocol. Do not just press random points whenever you remember. A structured routine performed consistently produces dramatically better results. The full routine should take approximately 12 to 15 minutes. Begin by sitting comfortably in a quiet room. Close your eyes. Take 5 slow, deep breaths in through your nose and out through your mouth. This pre-activates your parasympathetic nervous system and primes your body to respond to the acupressure. Start with large intestine 4, the hand valley. 2 minutes on the left hand, 2 minutes on the right hand. Move to pericardium 6, the inner gate. 2 minutes on the left wrist, 2 minutes on the right wrist. Move to liver 3, the great surge. 2 minutes on the left foot, 2 minutes on the right foot. Move to gallbladder 20, the wind pool. 2 to 3 minutes, both sides simultaneously. Finish with governing vessel 20, the 100 convergences, 1 to 2 minutes. End with 5 more slow, deep breaths. The American Heart Association recommends performing stress reduction techniques daily for optimal blood pressure management. Perform this routine once in the morning before the chaos of the day begins and once in the evening before bed. If you can only do it once, the evening session is more valuable because lowering your blood pressure before sleep allows your cardiovascular system to rest and repair during the night. Let me address the skepticism head-on because I know exactly what some of you are thinking. Pressing on my hand cannot possibly change my blood pressure. Yes, it can. Your body is not a collection of isolated parts. It is a unified electrical and chemical network. The nerve fibers under your skin are directly wired to the brainstem centers that control your heart rate and vascular tone. Stimulating those nerves sends a measurable electrical signal to the brain. This is not belief-based healing. This is neuroscience. Clinical trials with controlled groups and blood pressure monitors have documented the effect. The readings go down. The numbers do not lie. If this worked, my doctor would have told me. Your doctor has 7 to 12 minutes per appointment. They are managing your medications, reviewing your lab work, and documenting everything for insurance. They do not have time to teach you a 15-minute acupressure routine. Furthermore, most medical schools dedicate very little time to complementary therapies. This does not mean those therapies are ineffective. It means the system is not built to deliver them. You have to take ownership of this knowledge yourself. I can stop my medication and just do this instead. Absolutely not. Let me be crystal clear. Acupressure is a complementary therapy. It works alongside your medication, not instead of it. If your doctor has prescribed an ACE inhibitor, a calcium channel blocker, or a beta blocker, you take that medication exactly as prescribed. What acupressure does is help create the physiological environment where your medication can work more effectively. Many patients who consistently practice acupressure and other lifestyle modifications find that over time, their doctor is able to reduce their dosage. But that decision is made by your physician based on your clinical readings. You never, ever adjust your own medication. Hypertension is called the silent killer for a reason. You feel perfectly normal. You go about your day, you eat, you work, you sleep, and the entire time, the excessive force of blood pounding against your arterial walls is silently shredding the delicate inner lining of those vessels. That damage triggers inflammation. That inflammation attracts cholesterol and calcium deposits. Those deposits form plaques. Those plaques narrow the arteries further, which raises blood pressure even more, which causes more damage. It is a vicious, accelerating cycle. And one day, without any warning, a plaque ruptures, a blood clot forms, And depending on where that clot lodges, you have a heart attack or a stroke. In a matter of seconds, your life changes forever. Every single tool you add to your arsenal matters. Your medication matters. Your diet matters. Your exercise matters. And yes, spending 15 quiet minutes a day stimulating your vagus nerve through these 5 pressure points matters. It is one more layer of protection between you and a catastrophic cardiovascular event. You now have 5 precise, anatomically mapped pressure points. You have the exact technique to stimulate each one. You understand the neuroscience of why they work. And you have a structured daily protocol you can start tonight. This costs you nothing. It requires no equipment. It can be done in a chair, in bed, or on a park bench. And the only side effect is that you will feel profoundly calmer, less anxious, and more in control of your own health than you have felt in years. Think about who else needs this. Think about your spouse who was just told their blood pressure is too high. Think about your parent who is on 3 different medications and still struggling. Think about your friend who has a panic attack every time they sit in the doctor's office. Send this video to them right now. Share this link, text it, email it, post it. You are not sharing a random health tip. You are sharing a clinically supported, neurologically precise skill that could genuinely help someone avoid a stroke. Take the knowledge, press the points, lower the pressure. I am Dr. Franklin Reed. Take care of your heart, and I will see you in the next one.